We're here today with Warren Chin, DO, Assistant Clinical Professor of Family Medicine and Osteopathic Principles and Practice at the Lake Erie College of Osteopathic Medicine, Elmira campus. Dr. Chin, tell us something about yourself and your involvement with osteopathic medicine. How did it all start?
Well, your introduction was very impressive to start with, but I love osteopathic medicine. What I did was I started in osteopathic medicine because of Dr. Stanley Shiwitz, who was a guru in family medicine and osteopathic principles. And he was one of the ones that actually got me into it by fixing me where other doctors couldn't fix me. When I was in college, a 200-pound guy jumped on my back while I was on my stomach studying, and I had pain for over 2 years, and they couldn't figure me out. I went to all the hospitals and doctors at Columbia University, and none of them could figure me out, to the point where at the end they thought I was crazy. So my parents found Dr. Shiwitz. He immediately diagnosed me within minutes. And you know, he was kind of a funny guy. He said, "How'd you find it so fast?" And he said, "Oh, magic." And then he asked me, I asked him what he could do about it. And then he said, "Do you want me to fix it?" And I said, "Sure." And he fixed me in like less than a minute, whereas other doctors took 2 years and they couldn't even figure me out. And that told me something about osteopathic medicine that I needed to know and learn. And when I applied to medical schools, I applied to what my brothers went to, Harvard. I applied to New York Med. I applied to LECOM. I got into all three. And to the chagrin of my brothers, who are both MDs, I went DO. And I have never looked back. If I had to do it all again, I would go to an osteopathic college.
Tell us something about osteopathic medicine principles. What principles are they based on?
We actually learn more in osteopathic medical school, and we're given many more tools to diagnose and fix people. Okay?
Give us an example.
Well, like just the other day, I had a patient with upper abdominal pain, and she went through every test, including a lot of radiation, CAT scans of the belly and chest. She had ultrasound, she had lab tests, all was normal. So they didn't know what was wrong with her. I saw her within that week. She had been hurting for like 2 months. And I looked at her, diagnosed her, felt her belly. It was pretty benign. But I asked her what she did for a living. And she said she worked at Tractor Supply. And she had loaded 100 bags of 50-pound fertilizer. And that's when her pain started. And it hurts more when she bends over. So I looked at her back. She had a couple of vertebrae out of place. And you gotta understand, I'm not a chiropractor. What we do is way more gentle. You know, we actually aim. And what happened was, I put her back in place and her pain instantly went away. And I did stuff that these other doctors couldn't figure out. But that's because we have extra tools and ways to do things.
So I understand most osteopathic physicians go into some form of primary care, family practice, internal medicine, pediatrics, obstetrics. But is that the norm, or can you go into any specialty that you like?
You can go into any field that an MD can go into. It is your choice. Now, some of the fields are more amenable to the osteopathic principles, primary care for one. So family medicine, internal medicine, pediatrics. We have people that are just doing gangbusters in things like rheumatology and neurology, because most people go there because of pain. And if we can figure out their pain and fix it, then you are a kick-ass neurologist or rheumatologist. Okay, and we excel in all these places because of the extra skills.
And the DOs and MDs are currently in the same residency programs, correct?
Right.
There's only one postgraduate residency system.
They had decided a couple of years ago to put everything under one roof, the ACGME. And they basically, our osteopathic slots, which have been used for teaching osteopathic residents how to do more manipulation, they have gone to a lot of MDs. Now, I am teaching in a family practice program, but I'm teaching all the MDs how to manipulate.
How has it been received?
Well, I've spent the last 40 years improving how osteopathic principles are done in a more practical, more efficient, more effective way than what is generally taught in school. And I take the principles that I learned and I modified all the forces. When I was in college, I loved vectors, physics, and I changed all the vectors to be incredibly efficient.
You have a website explaining some of these techniques,
I have a website.
correct?
It's yeswecandomore.com, and it highlights a lot of the principles I use, and I just try to add to it every so often, so that it takes me probably, in a year, I probably can add a half dozen to a dozen new techniques. That each technique gets easier and more effective. And it's easy for even somebody who's not trained in osteopathic medicine to take on.
How would you suggest someone who's aspiring to be a physician experience and become familiar with osteopathic physicians and osteopathic medicine?
Well, I would do a rotation or shadow a physician or DO that actually manipulates. Now you have to specify that I want to shadow with one that does manipulate, okay? Because a lot of DOs sometimes, when they're exposed to just an allopathic or MD program, they learn to just practice that, which is a shame because every osteopathic student is being given a gift to be able to diagnose and fix more things than their allopathic counterparts. And you can either throw it away or use it. And they don't also realize that when you do osteopathic medicine, you can actually charge for it so you can monetarily benefit from helping your patients and doing more for them.
Great. Is there anything else you'd like to leave us with?
Again, if I had a chance to do it all over again, I would become an osteopath many times over, because I see how my brothers handle things. They're great doctors, but the osteopaths are taught to think outside the box as well, which a lot of doctors in this world, however, are unfortunately, they're sheep. They're told to do something and they do it. Osteopaths tend to think outside the box, and they can do what is best for their patients.
So it's something that's in addition to the conventional medical treatment, which is taught in every osteopathic school.
Right.
But then additionally, how many hours of additional training do DO students receive in osteopathic manipulative techniques?
Well, on average, MDs and DOs get 15,000 to 16,000 hours of training for clinical training, like in the hospitals and offices. And osteopaths actually learn a bit more, because in the osteopathic training in medical school, they get 4 hours a week extra training than MDs do. So you count that all up over 2 years. That's a lot of extra hours.
Well, Dr. Chin, thank you very much for taking us down your path in osteopathic medicine.
Thank you. I appreciate it.
Dr. Chin, tell us something about the application process for osteopathic medical schools. What kind of requirements are there? What are the schools looking for?
The requirements for both MD and DO schools are equivalent. But what DO schools do in general, especially at LECOM, Elmira, is that we look for other qualities other than just smarts. We look for qualities like empathy. We look for people that actually can care about their patients and people that can actually listen. A lot of times when you listen to what other doctors do, they don't listen. Especially with electronic medical records, it's become less personal. And I find DOs are a little bit more, actually a lot more personable, doing that same job as other practitioners. And because we can understand and look at other qualities in a person, I think we can pick better candidates.